It's Zambia. A Phoenix medical lead for Zambia. Thank you very much for joining us today at this time of the day. As you may all know, Phoenix Med is an international collaboration among medical doctors, students, and other health professionals from Zambia, Namibia, and Cardiff, pioneered by Professor Ho, with an aim of international collaboration through medical education as well as learning. And so we've brought you today's event entitled Career Insights into Hepatobiliary, Pancreatic, as well as Transplant Surgery by Dr. Jackson. A kind reminder that if you log in, just kindly mute your mic. And if you have any questions, you can type them in the chat box. And after the presentation, we're going to have a Q&A session at the end of the presentation in the interest of time. So at this point in time, I would like to introduce to you our guest speaker, who is a consultant surgeon and the only hepatobiliary, pancreatic, and transplant surgeon in Zambia, a country with a population of more than 17 million people. He is a clinical unit head at the Levi Mwanawasa University Teaching Hospital in Lusaka, Zambia, with more than 12 years of post-qualification experience in providing professional healthcare services to patients. He did his undergraduate studies at the University of Zambia and later a PhD study at Meiji University in Japan. And he supervises medical students and junior doctors in providing clinical care, surgical procedures, and research. As an hepatobiliary and transplant surgeon, he performs complex procedures in the management of the liver, pancreas, and biliary cancers, such as a Whipple procedure, pancreatectomies, liver transplant, among others. And he works with a multidisciplinary team of surgeons, radiologists, oncologists, and other research scientists. His clinical research is focused on surgical outcomes post-pancreatic surgery, esophageal cancer, and cholangiocarcinoma in Africa. He is currently the co-principal investigator of a multi-center prospective study evaluating the etiology and surgical outcomes of patients presenting with obstructive jaundice in Zambia. And he's also the co-principal investigator of a colorectal cancer screening study in Zambia. He has experience in medical education, specifically developed and coordinated a continued medical education series in hepatobiliary and pancreatic surgery in Zambia, and also a fellow of the College of Surgeons of East, Central, and Southern Africa, COSEXA, where he coordinated and facilitated the first memorandum of understanding between COSEXA and Japan Surgical Society. COSEXA, which is the College of Surgeons of East, Central, and Southern Africa, is currently operating in 14 countries in Sub-Saharan Africa. Our guest speaker is involved in faculty selection, leading surgical teams, and developing the hepatobiliary surgery network across the African continent. As a co-founding member of the Africa Hepatopancreaticobiliary Cancer Consortium, he looks forward to contributing to clinical research to further understand the epidemiology of hepatobiliary cancers, strengthening collaborations across the African continent and internationally with educational workshops, skills training to improve overall patient healthcare. Ladies and gentlemen, I present to you Dr. Jackson Chipaila. Dr. Jackson, the floor is yours.
Thank you so much for that introduction. I think you somehow feel like you've covered already part of my presentation, which was basically trying to say a little bit of myself, even before I go into the detail of hepatobiliary and pancreatic training. Okay. I'm having a little bit of a hiccup in terms of my slide moving. Okay. Yeah. So I think this is where it began from. I think I want to talk about a little bit about myself. I think in the introduction, so much has been said already about myself. Okay. So basically, I thought of saying a little bit about my roots. So I'm on this slide, I'm basically trying to indicate where I'm coming from. Okay. I'm a graduate of the University of Zambia. That's why I did my general surgery. I did my master's in general surgery from the University of Zambia, after which I did graduate and went further to do my fellowship with the College of Surgeons of East and Central Africa, called COSEXA. So this is a regional college in Africa. It covers East and Central Africa. When I finished my fellowship in general surgery with the College of Surgeons of East Central Africa, I further went on and did minimal invasive surgery at Nanfang University in China and in Guangzhou City. After that, that's the time I had an opportunity to go and do my study in hepatobiliary, pancreatic surgery and transplant at Mie University in Japan. In this picture is the faculty members of the of hepatobiliary and pancreatic surgery team at Mie University in Japan. Then of course here was my graduating day with my professor. This is Professor Shuji Isaji, who was and still is my mentor. These are my times. I think I spend most of my time in theater. And these were this is my team I had in theater. On my far right picture, I'm showing, I hope you can see my mouse, my pointer. This was after 2 years, given an opportunity to lead a pancreatic surgery. And for me, this picture reminds me of the great opportunity Japan gave me in terms of training in hepatobiliary and pancreatic surgery. This is a picture of myself within Zambia, where I sometimes get to travel in district hospitals. These are smaller hospitals in the outskirts of the country where they do not have any surgeons, just to go and offer some surgical operations and of course some mentorship to the local doctors in those districts. Of course, like everybody says, all work, no play makes Jack a dull boy. It's important to balance life. It's very, very important to balance life. Besides the whole theater time, the whole study, I still also have some fun time. I always have to find time to refreshen up myself. And what is here basically is just trying to indicate my fun time. This is myself supporting our national team. Our national team, soccer team, we call it Chipolo Polo, for other people who might not know. So I do have my fun time where I go watch live games. And of course, I have my time when I play my soccer, and I have my time when I have time with my friends, with fellowship. Right there, I was having time with my friends at church. So it's very, very important. Besides everything you do, you need to have time to freshen up. You need to balance up your life. I think this is something everybody has to learn to do. My story won't be complete without indicating that all this I've been able to achieve to this juncture has been because I also have a family which supports me. This little picture here is me. I think I was in my second grade primary school. And of course, standing next to me is my mother. And of course, this is a picture of my family and my little girls. hepatobiliary, pancreatic, and transplant surgery. The question is why HPP and transplant surgery? Then something I have to bring to your attention is that I was trained in Japan at Mia University. So the Asian part of the world, they call it HBP, whereas the west part of the world, they call it HPB. Otherwise, all in all, it's the same thing, just the different terminology. So in this presentation, I'll maintain it as HBP, which is hepatobiliary and pancreatic surgery and transplants. So if you find other literature indicating HPP, is basically just a preference between the two different regions. Yeah. So the question is, why HPP and transplant surgery? I think on my end, why I chose HPP and transplant surgery was, I think, because during my training during my residence training as a general surgeon, it was very evident. Yeah, it was very evident. It was very evident that this specialty of surgery was not handled within the country. So we had so many patients during my training that nothing was done about those patients with pancreatic pathologies, liver pathologies. Because of that, I felt the need immediately that there should be somebody within the country who should be able to pursue this specialty. And I gave it a challenge to myself. I gained the interest to want to go and do hepatobiliary and pancreatic surgery, simply because I saw it that no one was handling patients within the country who had these pathologies. So that itself motivated me. When somebody, I know I usually have a question most people get to ask is to ask why or how will I have to choose which particular specialty I should go and train in. I only have two questions for such people. My first question is always been, where is your interest? Where is your interest? Is your interest surgical? Is your interest medical? If your interest is surgical, then I'll further ask again, which part of surgery do you think your interest is in? Simply because I believe that, and I strongly believe that where your interest is, you will become good at it. I always get to have this feedback. I always get to have this feedback where somebody gets to ask me is that, but I have got interest in surgery, but I'm not good at it. I have interest in surgery, but I'm not good at it. This is where it comes in. What are you good in versus your interest? I always call the people who are geniuses as people who are lucky, simply because I believe a genius is a person whose interest in what they are good in it, they all go together. Most of people, or most of us, we have found ourselves interested in this particular field of study, while our strengths are in a different field of study. So the question is, how will I be able to choose which field of study I'm going to go into? Is it the one I'm good at, or is it the one I'm interested in? To handle that, for me, it's so easy. I always give this advice that please, all the time, choose the field you are interested in. Choose the field you are interested in, simply because every person becomes better with time. every person becomes better with time. So do not look at your immediate, or do not look at your immediate strength that, no, I'm not good at this. I'm not good at this. I'm only good in this particular field, yet I don't have interest. You know, any person with interest will surely get better with time. Things get better with time. This is something I've realized within myself, simply because during my undergraduate, during my postgraduate, I found myself to be quite good during all that time in pediatrics, in internal medicine. Yet my interests were always in surgery. My interests were always in surgery. And I took it up that I'll always go in for what I'm interested in. And surely today I look back and I look at myself and I've seen that where your interest is, surely with time, you become better at it. So whenever you are tied up with making a choice between what you are interested in and what you are good at it, please always, my advice is always go in for what you are interested in. And I'm hoping by the end of this talk, I'm going to give interest in some people in terms of wanting to do hepatobiliary and pancreatic surgery, simply because I feel this is a new, this subspecialty of surgery has just developed, well developed just in the few decades, So hepatobiliary is quite new. This is the reason why even up to date within the country, the number of people who are able to perform hepatobiliary and pancreatic surgery within Zambia is still limited. This is true also even in developed countries, that the number of people who are able to do hepatobiliary and pancreatic surgery is still limited. Yes, they have got the numbers, but it's still limited simply because it is a new field of surgery, and this is where surgery is today. So the next question I ask people is, what opportunities do they have in terms of training? What opportunities do they have in terms of training? And this is all the time a feedback where people are always gonna complain and explain that, but I would want to do this, but I do not have the opportunities to train. I want to give you some tips on this. Opportunities only come to those who look for them. Opportunities only come to those who look for them. Especially if you're in an environment like Africa, where opportunities, there is no deliberate policies within your countries which might promote some particular subspecialties, especially subspecialties like hepatobiliary and pancreatic surgery and transplant. Your interest in this particular field should be able to drive you to look for these opportunities. My first opportunity to go and train in hepatobiliary and pancreatic surgery came in my second year of my residence training in general surgery. Immediately, I was in my training of my residence program in my general surgery, when immediately I realized that, oh, I think, and I can see, it's so evident, we are having so many patients with liver and pancreatic pathologies, but they are not optimally treated. Immediately, I had that interest in hepatobiliary and pancreatic surgery. I started to look for opportunities. I started to actively look for opportunities. My first opportunity I had was to go and do a fellowship in hepatobiliary and pancreatic surgery at Karolinska Institute in Sweden. My professor in Sweden wrote to me and my institution then that, oh, we can give Jackson 2 years fellowship program to do hepatobiliary and pancreatic surgery and transplant. I had to look for that opportunity. I had to communicate to relevant people. Opportunities do not come on a silver plate. Opportunities do not come on a silver, especially if you're in an environment like which I trained in, like Africa. Of course, this is different with our colleagues in developed countries where deliberately there are these particular policies which promote these programs. So my emphasis is that opportunities do not come on a silver plate. Your interest should be able to drive you to look for these opportunities. Your interest should be able to drive you to look for these opportunities. I was unable to go to Karolinska Institute to go to Karolinska Institute to pursue my fellowship in hepatobiliary and pancreatic surgery, but that did not stop me from looking for other opportunities. I went further after graduating. I went further to apply at Mie University in Japan, again for hepatobiliary and pancreatic surgery training. Fortunately, I had an opportunity again to be accepted to go and do that training. Like that was not enough. I had to look for my own resources to fly to Japan to go and write my entrance exams so that I should be able to pass those entrance exams. Once I pass those entrance exams, then I'll be admitted into the university for my training. Interest had to drive me to look for these opportunities. So this is a challenge which I'm giving to you also, that anybody interested to pursue any form, but in this particular instance, hepatobiliary and pancreatic surgery and transplant, is that yourself, the interest in that field should drive you to look for these opportunities. These opportunities are available, and those people who look for them will definitely find them. I've just given you two opportunities which I had during my residence program, and it was during that time that I was able to be given this opportunity to go and train in hepatobiliary and pancreatic surgery and transplant. So once you gain this interest and you're looking for these opportunities, what are the requirements? What are the academic requirements which you should think of to have to enable give yourself opportunity? So even as you look for this opportunity, it is very, very important that you set yourself to a platform that once this opportunity is available to you, you'll be able to grab it. So what are these requirements which you need? So even as you look for these opportunities, it's very important that you begin to push yourself to have those requirements which you need to enable you to enter into this program. The first is, of course, the aspect of going into a medical school and getting your degree in medicine and surgery. Before that, for those people who are non-medic on the platform, you have got either dependent on your country and your educational system, you might need to have first a bachelor's degree in any biological bachelor's degree. Then of course you need to go into a medical school where they'll require you to have your pre-med courses done. Then of course you're gonna go into that medical college or university where you need to get your degree in medicine and surgery. This is as an undergraduate. Like I said, depending on which region and country you are in, the program requirements varies, but basically in almost all programs, you need to have a minimum of a degree in your medicine and surgery. At the same time, you need to already have had a residence program qualification in your general surgery before you are considered into a hepatobiliary and pancreatic program. Where in the place where I was trained in Japan, it requires you not only to have your residence program qualification in your general surgery, but also in gastroenterology surgery. Thereafter, then now you can go further and do your hepatobiliary and pancreatic and transplant program. This is slightly different for those people who would want to train probably in the US, in the UK, and also in places like India or China. But in all these, the minimum requirement would need you to have is, of course, your first degree in medicine and surgery and your resident program in general surgery. That is, you need it. Therefore, if you have your degree in medicine and surgery, immediately start thinking of finding yourself in a resident program in general surgery. Once you are done with that program, then immediately it means that you've put yourself on a platform such that when an opportunity avails itself, then that you'll be able to take it up and enter into a hepatobiliary and pancreatic and transplant program. Otherwise, without that, when you only have a degree in medicine and surgery without having any resident program in surgery, that itself will all the time disadvantage you, even when the opportunity avails itself for you to be able to do a hepatobiliary and pancreatic and transplant program. Once you enter the program of the subspecialty, or you enter the program of hepatobiliary and pancreatic and transplant program, what other subspecialties would you be able to find in there? Today, like I've mentioned, hepatobiliary and pancreatic and transplant program is not an old program. It's a new program. This is a program which has developed just a few decades ago. When coming into Africa, especially sub-Saharan Africa, it's still very, very new. Few countries are offering these services. So you have an opportunity to be able to do a standalone fellowship program in hepatobiliary and pancreatic surgery. You have an opportunity to do surgical oncology. When you're doing surgical oncology fellowships, this gives you also an opportunity to do hepatobiliary and transplant surgery. And of course, you have also an opportunity to do a transplantation fellowship. Questions come in, which one of these is better than the other one? Of course, each of these subspecialties have got advantages and disadvantages within and during the training. However, if you are beginning, doing a standalone hepatobiliary and pancreatic fellowship or program always gives you a broader view of the field of hepatobiliary, pancreatic, and transplant surgery. What are the training opportunities around for people who are interested in? What are the opportunities around for people who are interested in? Like I've mentioned, first of all, you need to understand what are the requirements you need for you to give yourself this opportunity. Once you have those requirements and you've been able to attend these opportunities, then it's important that now you be able to start finding places where to do. So these are just a few places which I'm going which I'm sharing with you, where you can do your hepatobiliary and pancreatic surgery training. Currently, the International Hepatobiliary Association avails fellowship program. So what the International Hepatobiliary Association has done is that they have set up fellowship programs which have been regionalized. So they have a program for Asia. They have the program for America. And they have a program for Europe and Africa. So for the people in Africa, these ones have been coined to do their fellowship program tied up with the European team. So that is a website. In that, when you click on that website, it will give you what your requirements are, and you are able to register and begin the program. Within Africa, we also have the Hepatobiliary Association of South Africa. They also offer a similar program like the International Hepatobiliary Association, but this is done from South Africa. Then within Africa, which countries would you consider where these trainings are offered? Of course, South Africa itself. South Africa itself offers this fellowship program. Apart from this fellowship program, South Africa itself has got universities where you can be given an opportunity to do your training in hepatobiliary and pancreatic surgery. Again, opportunities to go and do this training in this university is very, very, very limited. Therefore, if somebody is planning in, they need to deliberately contact the universities, at least plan 2 to 3 years before you are considered for your training. Like I've just given you an example of myself, where when I was basically in my second year of my residence training, which was a 4-year resident training in general surgery, I already made my contacts at different universities and institutions, and I've given you at least 2 institutions where I had positive response. Other universities I contacted, I did not have any response. It's too fine. The worst thing you can ever do is not to give yourself an opportunity. A negative response is better than not attempting. The other country apart from South Africa is Egypt. Egypt has got a hospital within Cairo, which is purely specialized hospital just on hepatobiliary, pancreatic, and transplants. Ethiopia is another country which fellowship programs are developing. South Africa and Egypt are the leading countries within Africa when coming in terms of hepatobiliary and pancreatic training and transplants. For these 2 countries, they are fully fledged. They are fully fledged, and their trainings are fully fledged. Away from Africa, of course, you might think of the countries within the European Union. You may think of America, and of course, Asia. Within these continents, if you are considering to do any training in the US, the only way it is possible if you did your degree in medicine and surgery in the US. So in the US, without your USMLE exams, there is no way you can be admitted into any resident program. It's not just possible. Whatever program you do from your university and from your country does not apply in the Western part of the world. That is in the US, that is true also in the United Kingdom. However, in Asia, Asian countries, they do still consider your training, your resident program trainings, which you do in your African countries. Therefore, this is the reason why most people within Africa, and not only myself, have been able to find themselves and given an opportunity to go and do these subspecialties within within Asian countries, simply because the Asian countries do not require you to go back and begin your undergraduate qualifications to enable you go into their resident programs. Which Asian countries are we talking about? China, India, and of course, Japan. When coming into Japan, probably I can even speak more. Universities, a good example is my local university, which is the University of Zambia. They have a memorandum of understanding with the Mie University in Japan, meaning that they are able to, these two universities have got a memorandum of understanding, and they're able to give opportunities to suitable candidates to do particular trainings in their university. This is true also to able to do fellowship programs in India. So as of now, these two Asian countries, I think, countries people should be able to consider consider in order to pursue their training, because as of now, their requirements are slightly more flexible than most countries in the West. After the all work has been done, after all work has been done as a hepatobiliary surgeon, how would you make yourself happy? What do you go to show off for? The earnings and the salary of a hepatobiliary surgeon varies from region to region. However, I would just give the ratings, which are ratings within Sub-Saharan Africa, and deliberately give the ratings in terms of per operation you do in the private sector as a hepatobiliary and pancreatic surgeon, something to smile about after the long training, the hard work. What is it there to show off for? Within Sub-Saharan Africa, for a beginning level per operation, meaning once you do one operation, you are expected to walk away with at least $1,000. For particular cases, you can walk away as high as $4,000 per case. When I want to be kind enough and average, what is it you are expected per case, per operation you do in the private sector? Probably $2,000 on average is what you need to tag yourself, and what is what is tagged within Sub-Saharan Africa per operation you do. So meaning that as a hepatobiliary and pancreatic surgeon, you don't need to operate on a daily basis. And this is true simply because for a hepatobiliary and pancreatic surgeon, most of the patients you're going to have is that by the time they present to you, most of the patients already have their cancers and their tumors at a stage where they're not operable. However, you all the time going to have a few other patients you are able to salvage. So meaning that imagine you only have 2 patients to operate in the private sector in a month. It's enough for you to work out in that particular month with an average of $4,000. I think that is good enough. This is obviously way better than a monthly salary of a doctor within this region per month. two operations of a hepatobiliary and pancreatic surgeon pays more than a monthly salary of a doctor within sub-Saharan Africa. So the upside of being a hepatobiliary and pancreatic surgeon is the fact that you will be an abdominal champion. What I mean is that as an HPP surgeon, any pathology within the abdomen, and not only within the pathology within the pancreas and the liver. Remember, before you were a hepatobiliary and pancreatic surgeon, you were a general surgeon or a gastroenterology surgeon. Then you further up and do hepatobiliary and pancreatic surgery. This itself gives you the skills, the know-how you need to be able to navigate within the abdomen with ease and comfort. Hence, my disclaimer to say that you become an abdominal champion. As a hepatobiliary and pancreatic surgeon, even if you were left alone, in the absence of a gastroenterology surgeon, you'll be able to save many other patients simply because as a hepatobiliary and pancreatic surgeon, yet you respect the aspect of multidisciplinary approach, but where the gastroenterology surgeon is absent, you as a hepatobiliary and pancreatic surgeon, you are able to handle those cases, which is not true for a general surgeon and a gastroenterology surgeon. This is what makes us abdominal champions. And the other upside to this, hopefully, is that money problems should not be a frequent occurrence in your life, simply because as a hepatobiliary and pancreatic surgeon, deliberately we tag ourselves at a high notch. We tag ourselves at a high notch. Therefore, as a hepatobiliary and pancreatic surgeon, once you're done with your job, it is believed that money problems should not be a frequent occurrence in your life. Just doing that training should push you away to some of these financial problems. To every upside, there should always be a downside. What is the downside of a hepatobiliary and pancreatic surgeon? Is that even if you earn this much, you might not have time. You have to sacrifice time simply because the procedures, the operations you need as a hepatobiliary and pancreatic surgeon are almost all the time long operation. When coming into a WIPO, on average, in a high-level specialized centers, it takes at least on average of 8 hours. Within our setting, where we are just beginning and creating a team, it takes us almost about 12 hours. So the long operating time, the long standing is a downfall to it. This is the reason as a hepatobiliary surgeon, there is need for some level of fitness. There is a need for some level of fitness for you to be able to stand and able to do and able to stand for this long operating time. After all has been said and done, it's important to realize that the purpose of life is not to be happy. It's to be useful, to be honorable, to be compassionate, to have it and make some difference that you have lived and lived well. And this should always drive us in whatever we try to do. On my end, I saw and I still see the need for most people to be able to train and become hepatobiliary and pancreatic surgeons, simply because we are very, very, very few. There is so much opportunity to make a difference in people's life. And that is the essence of life, to be able to touch that particular person. And indeed, we have so many patients with liver and pancreatic pathologies, yet we have very few hepatobiliary and pancreatic surgeons. Therefore, my plea is that let many join this noble profession. Thank you.
Thank you very much for that presentation, Dr. Jackson. Indeed, it was very insightful to hear that over time, everyone usually gets better, and so we're advised to go for what we find interest into. And over time, we need to seek opportunities, because opportunities will come to us, but we have to attend the requirements as well as seek them. And there you have it. Those of us who want to be abdominal champions and not to worry about money problems, we have been inspired into that field. So at this point in time, we're just going to check the chat box on some of the questions that are there so that they could be addressed. So the first one is coming from Amanda. She's saying, this point that you made is so inspiring, and interest is that takes you far. What would you say were the 3 top highlights of your career so far? What would you say were the 3 top highlights of your career so far? And how do you see yourself in a few years in the medical field? How do you see yourself in a few years in the medical field? And do you have any special projects you have been working on, or any other plans for your career? Dr. Jackson, if you could answer those, that's when we proceed to the next set of questions.
Okay. What are my 3 top highlights? Well, where did I start? Let me start from down going up. What projects am I working on? Yeah, what projects am I working on? I think in the introduction, yeah, I think you indicated part of the projects which I'm involved, in. Currently, a pioneer of the African Hepatobiliary and Pancreatic Consortium. This consortium is a consortium which comprises not only hepatobiliary surgeons, but hepatologists, scientists. The whole idea is to increase understanding of hepatobiliary and pancreatic pathologies within the African population. So the essence of the consortium is to be able to improve in terms of research abilities within the continent, and also to undertake particular within the continent. This is one of the projects. The other project is that I'm also involved in improving endoscopic services within Africa. I'm currently sitting into a committee at the World Endoscopic Organization. This is the World Endoscopic Organization. I'm sitting in a committee which is looking in terms of increasing the endoscopic services within Africa. As a hepatobiliary surgeon, I definitely need a lot of endoscopic services to enable me operate on my patients. Endoscopic services optimizes most of my patients. So I'm involved in this project where we are trying to increase endoscopic services within Africa. So I'm sitting on that committee. I'm sitting on that committee at the World Endoscopic Organization. Yeah. How do I see myself in the future? I think currently, for me, I always tell myself is that I am pregnant for hepatobiliary and pancreatic surgery, and I need to give birth to it. I need to give birth to it, and giving birth not meaning that I need to reach a point where I'm able to sit down, yet operations and the service in hepatobiliary is taking on. As at now, all operations are dependent on me in my country. I find it very wrong. So I look to a point where I should be able to be, not to be available, go out on my holiday, yet my countrymen, my people within the continent are able to receive hepatobiliary and pancreatic surgery and services. My three top highlights. What are my three top highlights? Quite difficult question for me to isolate what my highlights have been. Otherwise, I think the most important aspect, which I look back and gives me a smile, is the feedback I think I have from my various patients I interact with. In this interaction, is not only interaction in terms of the outcomes of the surgeries I have done, but in terms of how receptive I have been to some of the patients and the feedback they have been able to give me. I think for me, it's something which all the time brings that smile back to me. Secondly, something that probably I would also isolate as part of my professional highlights has been, I think recently, it's something I didn't post. In my presentation. Recently, I think the Zambian government did acknowledge the fact that since my coming back within the country, I have been able to save monies which the government would have used to refer some of these patients to developed countries to undertake some of these surgeries. I think those I might isolate them as my highlights so far.
Thank you very much for that response. Other questions? I think, how often are transplant-related surgeries done in your field, in your country? And the second question is that how do you usually reconcile the lack of adequate equipment that will facilitate your specialization in Zambia?
Thank you so much for those questions. Again, I'll answer the questions from the last one, and then I'm going to end the second one to the first one. Yeah. So in terms of equipment, I think your concerns and your question are absolutely something I do understand, and these are the true challenges I have on the ground. Those are the true challenges I have on the ground. Yeah. But like I mentioned, where there's interest, you're always going to push yourself to be able to do some of these things. Indeed, when I arrived in Zambia, I was alive to the fact that equipment was a challenge. So the first thing I did was have a meeting with particular pharmaceutical companies, particular suppliers who I believed and trusted would be able to supply the needs I need to enable me to undertake these operations. So I engaged them to be able to stock some of these things. Remember, sometimes we don't have simply because there is no one to make use of some of these equipment, some of these consumables. But once you have a human resource to make use of them, even the other people on the business aspect will be able to provide. So the aspect of having a skilled human resource, I think, is cardinal to advocate and able to source the particular equipment and consumables needed to enable you to do these operations safely. So that was my first task. So what is happening on the ground is that through my hospital does not have everything I need. However, these particular pharmaceutical companies and these other suppliers who have been able to engage, they have been able to bring the things I need. Therefore, all the time, I'm able to have the patient share the cost. So if I have to do a particular operation and I look what I don't have in theater to use, I all the time get back to my patients that we need to able to buy 1, 2, or 3 things to enable us to do this operation safe. And this has worked out. Unlike the situation where even people with resources were unable to receive a service. Currently, at least, indeed, we might not be able to provide this service to every person who might need it, but at least those ones with resources, they are able to receive this service. For me, I feel it's a better situation we are in, unlike before, where nothing could be done to either one with resources and one without resources. So that is how I've been able to meet up this equipment and consumable issues within my hospitals. You know, for you to do pancreatic surgery, you cannot do it without energy devices. You need a ligature, you need a harmonic scalpel, you need all these available. The cost of a ligature within Zambia, the Maryland ligature within Zambia, a disposable Maryland forceps costs about 18 kwacha. 18 kwacha is equivalent to almost 19,000 kwacha. 19,000 kwacha is equivalent to almost like $1,000. Yeah, almost like 1,000, just less than that, like $900. Yeah, so $900 for an average Zambian is too costly. However, even for those people in Zambia who are able to have this $900, were unable to receive the service. But with at least a trained human resource, we've been able to do that. Secondly, transplant. How many transplants are we doing at the hospital? We are still babies. We are still babies. We are not yet doing any transplant within Zambia. Remember, currently, I'm the only hepatobiliary and pancreatic surgeon in the country. I have to give birth to others. I have to have others come in to join me. I have to have others get motivated to go and train. For you to do a transplant or begin a transplant program, you need a team. Transplant program is not a program you can do as an individual. So you need to develop a team. So this is where we are at. We are just beginning to develop this team. We're just beginning to develop this interest within the country. However, having spent time in a hospital where transplants were being done, in Japan, 90% of our transplants were living donor liver transplants. living donor liver transplant, we only had less than 10% the deceased donor liver transplants. Today, I stand in and believe that this is feasible even within my set in Zambia once we develop that team and of course increase in terms of the needed equipment.
Thank you very much for that response. And I'm sure the next question was similar to what I asked about. It was from Wenda, whether there are any transplants being done in Zambia. And I think just the last question, I know we've passed the mark. We apologize for that. Are there, apart from training these individuals, what improvements have been made to improve this field? I think that was the last question from Wenda.
Yeah, what strides have we done to improve this field? Yeah, recently, I was involved in developing a fellowship curriculum under the University of Zambia. Yeah, I was involved in developing a curriculum under the University of Zambia, where we have submitted to the university a proposed curriculum, a fellowship curriculum under the University of Zambia, which is under review. Yeah, so the first thing is developing human resource. So as of now, we have already pushed in a proposal to begin a fellowship program within Zambia. Training within Zambia will increase the numbers we need. Like I've said, it's about creating the opportunities and creating the interest in people to be able to do the training. The next question is, what else will you be able to do? You cannot train a hepatobiliary and pancreatic surgeon as an individual. You need a faculty. Like I mentioned earlier, that we already have a memorandum of understanding with some universities where they have already got developed hepatobiliary and pancreatic programs. A good example is Mia University. My institution where I was trained, they are ready to be sending in faculty members to come in and give lectures, do some training within our students who will be admitted under the University of Zambia doing their fellowship program in hepatobiliary and pancreatic surgery. So the strive we have made is that we want to begin our training locally.
Thank you very much for that, for those responses, and we've come to the end of the session. We apologize once again, we have passed the 1 hour mark by about 10 minutes, but just some few comments to say from Tiambeka to say thank you very much, Dr. Jackson, for the wonderful insight. As a medical student, you've sparked my interest in hepatobiliary surgery. All the best of success for the continuing endeavors. And once again from Amanda is that thank you very much for the responses as well as the presentation. And all the best and inspiring, formative talk from Nathan. And once again from Toshiki is that thank you very much for talk, Dr. Jackson. That was informative and inspiring presentation. And once again, the last comment from Wenda is that thank you so much. We've actually been enlightened. So thank you very much, Dr. Jackson, for sparing your time from your busy schedule and giving us this presentation. And we've come to the end of the presentation. Are there any final remarks before we close the meeting?
I just want to thank you. Thank you for giving me this opportunity to be able to address the audience. I think on my end, like I mentioned, I would want many others to be able to join us into this field. So this opportunity for me was timely, and thank you so much. And wishing you all the best on this platform.
Thank you very much, Dr. Jackson. If at all we need other presentation, we'll call again on you. Are there any announcements from Perina?
So, thank you very much, Dr. Jackson. That was such an interesting and inspiring talk. I think I speak for all of us when we say I think the thing that really stood out to me was choose the field that you're interested in. And even though you might not be confident at the beginning, you will get confident or get better in that as you progress and as you experience experiences. I guess what I have to say is, I think Amanda's posted this on our Facebook about the Judith, Professor Judith Hall has posted the on the 17th of June day about anesthetics and intensive care. So that should be interesting on the 17th of June. So register if you haven't. And what else? I think so for our next event, it is by the Cardiff lead. So Nathan and Priya. So that should also be interesting. So stick around for those ones, register for those ones as well. So yeah, that's all I have to say.
Thank you very much for that, Perina. This recording will be shared on our social media platform, especially on our YouTube channel, and others will be able to access it, and you can put comments and other feedbacks there. So any other closing comments, Amanda?
Hi, can you hear me?
Yes.
Yeah, just a massive thank you to Dr. Jackson. I think it's so inspiring that he's the only one in Zambia doing this and starting this initiative. So thank you so much for taking time to talk to our fellowship and these amazing students from other countries as well. I'm sure everyone was very inspired by your talk. And thank you so much to Anthony and Perina who organized this beautifully. And we're so glad to have them as leads in our Phoenix MedEd team. So yeah, I would encourage everyone to, just as Perina mentioned, to keep updated on what Phoenix MedEd is doing, because there are lots of amazing things happening in the future. And Dr. Jackson, I hope that you also embark on this journey with us and you also get involved in our future events. So thank you very much to everyone that came today, and thank you Anthony and Perina again.
All right, thank you very much everyone for coming today. Others that have left, I think we've come to the end of the meeting. I'll leave you now to enjoy the Saturday. Bye.